I am going to paint you a picture of Lake Superior Quality Innovation Network's success in achieving the goals of the QIO program in Michigan, Minnesota, and Wisconsin. I'm Jennifer Lundblad, President and CEO of Stratus Health, which leads Lake Superior Quinn, together with Metastar and Empro. I'm going to illustrate our success, painting by numbers. I'm proud to share how 924 healthcare and community organizations in 27 communities across our 3 states are participating in care coordination activities to reduce avoidable hospital readmissions. Let me color in some of the detail for how that's happening. Lake Superior Quinn offered motivational interviewing workshops so healthcare staff can provide goal-oriented, client-centered counseling that engages a client's intrinsic motivation to change behavior. Interventions like this have contributed to 7,168 fewer 30-day hospital readmissions and impact the lives of 63% of the Medicare fee-for-service beneficiaries in our states, more than 1.5 million people. Now let's frame the true picture of success. Lake Superior Quinn worked with a health system who provided care for Clyde, a 93-year-old man who had multiple hospitalizations following quadruple bypass surgery, with subsequent heart failure and atrial fibrillation diagnoses. Clyde was unable to manage his swelling, shortness of breath, weakness, and anxiety attacks due to his health condition. Then, a nurse practitioner tailored Clyde's care to his values, beliefs, and personal goals. Clyde was able to follow the medical plan, and he now functions well in his assisted living environment with no further hospitalizations since he began to receive this person-centered care. Continuing Lake Superior Quinn's picture of success, I want to share how we're working with 933 nursing homes. That's 78% of all homes across our 3 states, to improve care for their residents. We're particularly proud of our progress in reducing the number of residents taking antipsychotic medications as chemical restraints for so-called behavioral expressions, actions such as verbal outbursts and attempts to leave the nursing home. Lake Superior Quinn is providing group and one-on-one technical assistance to move our homes toward using person-centered care techniques that address why residents feel the distress that leads to these actions. 7,371 fewer residents in our region's nursing homes are taking antipsychotic medications as a result. The use of antipsychotics has declined to 13.1%, below the national average of 15.4%. But our best measure of success? Knowing Medicare consumers receive better care. Like Mr. G, a resident in a nursing home that works with Lake Superior Quinn. Mr. G was able to stop taking the antipsychotics used to manage his behavioral expressions. Nursing home staff talked with his family and learned that he used to work as a janitor and enjoyed fixing things. They identified ways that Mr. G could help with tasks like checking handrails and fixing door locks. Being able to tinker was truly his best medicine. Looking at our paint by numbers of success, I think you're starting to get the picture. Now for the finishing touches on Lake Superior Quinn's picture of success. Among our 600-plus recruited primary care practices, 52% of our Medicare patients are screened annually for depression, higher than the Quinn QIO average of 19.6%. Our Painter's Box included a learning and action event about the depression screening tools PHQ-2 and PHQ-9. Multiple presenters shared their experiences and the benefits for both patient and physician to ensure appropriate care. Presenters gave tips and shared success on how to implement these tools into the clinical workflow. To illustrate our work in action, one of our partners integrates behavioral health into primary care and uses the PHQ-9. Their patient, Dwayne, has a number of chronic conditions, numerous hospitalizations, and was identified as suicidal through the PHQ-9 screening. In working with Dwayne, the practice was able to improve his medication adherence. He has reduced his suicidal thoughts and has had no subsequent hospitalizations. And there you have it, Lake Superior Quality Innovation Network's picture of success.